Doctors screamed when woman gave birth and toilet her unborn baby turned be something else. Lauren, the unlucky woman, said that when her pregnancy test came back positive, she was excited about starting a second family. When she was around 6 weeks pregnant, she thought everything was going according to plan. She had seen some va-inal spotting at the time, but she didn't let it worry her. She nevertheless visited the hospital to get herself examined. Lauren's molar pregnancy, which seemed to be a typical pregnancy from the outside, was what doctors diagnosed her with. Lauren was informed that there was no baby growing inside of her following many scans. What she actually had was a malignant growth developing within her womb. She had a malignancy that required rapid medical attention. The woman said that the tumor developed in her womb in a similar manner to how a baby would. The same hormones were released, and her pregnancy tests consistently showed that she was pregnant. While I had no way of knowing it was cancer, I underwent further testing when I was 7 weeks pregnant and started bleeding. Lauren had to go through several rounds of chemotherapy and other treatments after being diagnosed in order to get the tumor under control. Lauren endured several trying months of therapy before one day, while she was in the hospital, she found herself in agonizing pain. I was experiencing more severe lower abdomen aches. I quickly realized that my discomfort was familiar and that I was in labor, said Lauren. The tumor that had lived inside of my womb for the previous 5 months was born that night in the hospital restroom using a bedpan over the toilet. The nurses found it confusing. In all their years, they had never witnessed anything like that. The physicians were shocked when they were called in, the mother said. According to The Sun, Lauren expelled a pear-shaped object from her body and claimed, "I gave birth to the mass in the bathroom." That was a large tumor to push out on its own because, at 17 weeks, it was the same size as a newborn. When I noticed the tumor in the toilet, I was ecstatic because I felt my agony was finally ended. Her unique delivery signaled the conclusion of her treatment at that precise time. When Lauren first eagerly spotted the tiny blue line on the stick months ago, she said, "It couldn't have been further from how I'd envisioned my pregnancy ending up." She was relieved of great anxiety, but a new worry, whether she would become pregnant again, took its place. Lauren ultimately gave birth to a child and gave her son Charlie a baby sister, despite her worries.